there's just so much.
You're listening to a Mamamia podcast.
Australian women, welcome to your Full Body Health Check. I'm Claire Murphy, and as we're talking about making babies in today's episode, I will let you know I'm a one and done mum to a 10-year-old teenager who is currently outside the studio probably thinking how cringe mum is.
And I'm Dr. Mariam, a deeply grateful, slightly frazzled mum of rainbow twins. My journey to motherhood was a little rough. 3 years, 2 miscarriages and a stillborn. But I'm incredibly grateful for the journey, and I have my 2 beautiful boys.
And if you want to have a good cry, go and look at Mariam's post for Mother's Day this year because, I sobbed.
Aw, gotta keep it real.
Yeah. As I mentioned, we are talking about conception and fertility today. We are getting up close and personal with sperm and eggs.
Yum.
Which sounds like a really gross breakfast menu. We'll find out what you can do to have the best chance at getting pregnant, what men's roles actually are, and plot spoiler, it's a lot more than you think or that we've been joking about over the years. And we'll find out when we should turn our attention to IVF as well. We'll also be answering a question from Maria, who's been told her anxiety and multiple dental fillings could be signs of something bigger going on in her gut.
Yep.
But next, how does a weird thing in your ear tell you that you possibly have heart problems? We'll find out because it is time to go to med school.
Welcome to med school.
So, Mary, when you think about signs that you might have cardiovascular disease, you might think, chest pain, shortness of breath, maybe dizziness, heart palpitations. But have you checked your Frank's sign?
My Frank's what?
Yeah, that was what I was questioning when I was doing some research for the show and found out that a Frank's sign is a crease on your earlobe. So sort of from where your ear hole is, it runs down towards the bottom of your earlobe. And that has been associated with a higher risk of coronary artery disease and some other cardiovascular conditions. Some studies are even suggesting it can be a prediction for future cardiac events. And the longer and deeper it is, the thinking is you are at a higher risk of these things. Now, let's just
take a moment.
Let's take a second here before we all run to the mirror and check to see if we have a Frank sign. My husband has them.
Oh, really?
Which I checked on him. Yeah. And so he's already had a heart check. He's fine.
Yeah.
It is not a definitive diagnostic tool. So you can't just say, you've got a Frank sign, you're definitely going to have a heart attack. That is not what we're talking about here. It's just associated with the loss of elastin and elastic fibers, which is the same process that damages blood vessels in cardiovascular disease. Humans are so weird.
The human body is full of so many little quirks. I mean, who decided the earlobe was the heart's messenger? I wonder what our ears are trying to tell us. But that said, you're right, there is no direct link, so we don't need to freak out, but it's always a good idea to get a heart check with the doctor, especially if you're over the age of 45.
Can I look at your ear?
Yeah. I have the cutest ears. They're so
tiny.
Do you?
I've never looked at your ears because it's always covered by your hair.
Like my husband's favourite quality of mine.
Oh, stop it. Oh, they're so cute and tiny.
Yeah, no, they're really, really cute.
You don't have a Frank sign. No. Neither do I. That's a relief. Okay, let's move on, shall we? Because it is time to talk about conception.
It's time for the checkup.
Mariam, did you see those guys who held a sperm race
That
recently?
was like the best race I've ever seen.
It's wild. Like if you haven't seen it, we'll put it up on our socials. They're close up. They did talk about the process of how they selected the fastest wrigglers for this race, but they move so damn quick to be the first to make it to the egg.
So good. When I was watching it, I was thinking, was there a process? Did they have to ejaculate at the same time? And then I was just wondering how it was designed for fairness, right?
No, there is a follow-up video to the one that we've all seen where they talk about the process because they had to spin out the duds.
Yeah.
To get the fast ones.
Awesome. Yeah, and they are fast. But in reality, sperm swims about 5 millimeters a minute, which sounds slow until you realize how small they are. But, yeah, it was hilarious. It's a good reminder, watching that race, you're seeing the sperm just kind of slow down or go backwards or run into the wall. So while it was fun, it's kind of a cheeky reminder that sperm quality matters and both partners need to be checked if you're having trouble conceiving because sperm health also matters.
This is something I've just realised after now being served a million sperm videos in my timeline, is that you think that when a man ejaculates and the sperm comes out, they're all just on this charge to the egg. Some of them are born with like 2 heads. Some have 2 tails. Some have like a wonk neck, so they can't go in a straight line.
Battle of the sperm zombies.
Some have a tiny pinhead, and some of them like go in a circle. Like, so don't think that all your sperm is just like all magically making a run for the egg. And also, even when they get there, the egg decides which one of you is going in.
Exactly.
So like you can get there first. You might not necessarily even get in there. I would like the best of you if you don't mind. All right, let's start this fertility journey today, Mariam, with the first stage that many of us go through in our lives, and that is desperately trying to not get pregnant. There is currently a lot of conversation happening online right now about the oral contraceptive pill and the fact that the World Health Organization has it as a class 1 carcinogen. Can you help us out here, because it actually has a lot of people scared about taking the pill?
Yes, so it is true. The World Health Organization has classified the combined oral contraceptive pill as a class 1 carcinogen. It sounds scary, right? But let's try to break it down so we understand. So the classification does not mean the pill is as dangerous as smoking.
Because tobacco is listed in that category too, right?
It simply means that there's evidence that it can be linked to certain cancers in humans. But you know what else is a group 1 carcinogen? Sunlight, alcohol, processed meats. It's about evidence of a link, not about how dangerous or how much you need to be exposed for it to be harmful. So here's where the context really matters. So short-term use of the pill increases the risk of breast and cervical cancer, but here are the numbers. About 1.5 extra cases per 10,000 women if you start it in your early 20s and continue it for several years. Cervical cancer risk increases mainly if you've been taking it for over 5 years, but that risk returns to baseline within 10 years of stopping. But it's really important to remember that almost all cervical cancers are caused by the persistent HPV infection. So the pill may act as a cofactor, but it's not the cause. And now here's the part that those wellness influencers generally skip. And we know that the pill is protective against cancers like ovarian and endometrial cancers, and that effect can last decades after stopping. These are the harder to detect cancers, especially ovarian, and that protection is significant. There's even some emerging evidence that it might reduce bowel cancer risk as well. In fact, the Cancer Council Australia states that the reduction in lifetime risk of some cancers outweigh that temporary small risk in others. So here's your action plan, not your panic plan. So if you're worried, talk to your GP, especially if you're over the age of 35 or you've got family history of breast cancer or you have risk factors. And stay on top of preventative care. Get your cervical cancer screenings every 5 years from the age of 25 to 74 and your mammograms every 2 years. So don't make health informations based on videos like this. They trend for a reason. They can be fear-mongering, but, if you've got any concerns, any queries, just have that conversation with a trusted health professional.
Absolutely. All right. Can you explain the fertile window?
So what is the fertile window? It's that 6-day window where you're most likely to get pregnant. It's the 5 days before ovulation and the day of ovulation itself. So yeah, it's not just one magic day, it's a whole fertile window. So when does ovulation actually happen? So most apps assume that you have a 28-day cycle and they will say that ovulation would be on day 14. But realistically, not everyone has a 28-day cycle. Some are longer and some are shorter. So generally we subtract 14 from the days. For instance, if it's a 35-day cycle, you might ovulate on day 21. But yes, pregnancy is possible outside this window, especially if you've got irregular cycles, you're stressed or you're unwell, that can all mess with your ovulation. And if you're not planning a pregnancy, don't rely on these apps. You need to rely on consistent protection, whether that's contraceptive pill or condoms, barrier methods, whatever it might be. And not withdrawal.
As Mariam's twins can attest to.
Yeah.
Finally, Mariam, how do we speak to our doctor if we are struggling with fertility?
This is such a tender and important question. And first I want to say, if you're in this space and you're trying and you're not seeing that positive on the pregnancy test, my heart is with you. When it comes to fertility, we often hear the old advice, which pisses me off. Just keep trying, just try for another year. But here's what you might not know. You don't need to wait a year of trying if you feel something isn't right. You know, the consensus is if you're under the age of 35, try for a year and then see your GP. If you're over the age of 35, try for 6 months. But I'm just going to say something a little bit controversial. If you don't feel something's right, I think seeing your doctor for a preconception check and telling them I don't feel something is right, might we test for something to see if something is wrong? And you can do that earlier. I think for that reassurance, and especially if we find something earlier on, I'd rather see that at the 3-month mark than have them waited 12 months. So starting the conversation can feel intimidating, but it doesn't have to be complicated. Just going to your GP saying, look, we have been trying to get pregnant. It hasn't happened yet. I'm worried. Can we talk about what tests or options I can consider? And a good GP will listen. They'll offer initial investigations. They'll get your partner to come in, remembering it takes 2 to tango. Your partner's health is equally as important.
And we don't know how many wonky sperm he has.
Exactly. And it's also okay to bring up the emotional side because that's a big part of the journey. You know, there's the stress, the anxiety, the sense of urgency that creeps into every cycle because it's not just a medical journey, it's a deeply emotional one as well.
Okay, coming up, a friend of Maria's got a recent diagnosis, and when she shared some of the lesser-known symptoms, she realised that could be her too. So we'll find out whether teeth and fingernails might be a way to look into an issue of the gut. But next, we're speaking with obstetrician and fertility specialist Dr. Justin Tucker to get the lowdown on getting pregnant. Today, we're speaking to Dr. Justin Tucker. He's an obstetrician and a fertility expert from Prologue in Sydney. And we start off by asking, what is the most common reason that Aussie women might find it hard to fall pregnant?
I think a big thing to get across is that everybody's individual. I always say that fertility is like a card game. You get dealt a set of cards. It doesn't matter what anyone else has got. You've got to play with these. And I guess a potential trap is to, jump online and try and compare your scenario with others when getting personalized feedback with a thorough, methodical approach to investigation will give you knowledge. Doesn't mean you're obliged to do anything with that knowledge, in terms of moving to treatment. Patient sets the timeline, but work with facts rather than guessing.
I feel like this is going to be a lot of answers to questions where it comes to
I didn't answer the question. Very politician of me,
But it's true, though. Everyone's experience is so different. So we do have to bear that in mind when we talk about these kinds of things.
And it's not, you got to look at the whole combination, And so for sure, it might be things like not ovulating or a sperm defect that are sort of the big, most common ones. But you don't want to get tripped out by a small little thing that you find 6 months later, It's better to know, again, all the information right up front, although that can sometimes be confronting for people to really step up and learn that. It puts you in a position of power, which is important.
Well, can we talk about some of the information that I've seen floating around on social media? There's this video doing the rounds of a 2008 study that claimed scientists put dogs in pants and found those wearing polyester, 75% could not get pregnant, and that their progesterone levels had dropped, possibly due to, they were saying, the electrostatic field that interfered with hormone signals. We also hear a lot about men supposedly not wearing tight pants to save their sperm. So can the clothes you wear actually impact your fertility?
Yeah, so those two things are a little bit different. Exactly. If only it was easy as not wearing polyester pants, huh? And I think the thing that again comes into my mind is how vulnerable you are as a patient when you're out there getting constantly bombarded with all this information of different quality.
Yeah, because now you're looking around your wardrobe going, is my activewear making me infertile?
Exactly, yeah. And that's, again, something we need to keep in mind as we're investigating fertility and thinking about doing some interventions is making sure that they're evidence-based by good quality evidence, guidelines, and aligned with the patient's preferences and priorities. But, we want to go where we're going to get return and not setting up this paradigm where it's almost impossible to follow. And then when you break it and you read the label on these pants and it's got polyester in it and that's why I didn't get pregnant. So again, maybe to try and answer the question is no, that quality of evidence isn't good. We want to look at all possible interventions, but the type of clothes you wear, particularly as a female, is not going to be a high yield investment in terms of improving your fertility. Men may be a little different. Testicular temperature and things like that are important. But again, if we've got normal sperm function, we don't want to go changing things too much. We've got to keep it doable.
Can you give us an idea on sort of an average basis, how long it normally takes to get pregnant?
So again, we never really know the probability for a certain couple, right? And so some people are going to be lucky and get it really early and some people are going to be unlucky. and get it later just because of the probability. Think about rolling a dice. Yeah. You can because of the probability. Think about rolling a dice. Yeah. You want a number 6. You can get a 6 first roll, or sometimes you need to roll it 10 times to get that 6. And again, it comes back to really working out what that probability is as accurately as we can with some baseline investigations. They, out there, it said if you're less than 35 and it's taken more than 12 months, that might be a trigger for investigation. Over 35 and it's taken 6 months, then same deal. But again, some people may want to investigate earlier just to be more informed, and some people might want to take it a little slower.
Well, can we talk about that age thing? How much does age actually impact your fertility? And I'd like to get your take on the pros and cons of younger v older, because it's not all doom and gloom for women who have babies when they're older. Plus also it's not all sunshine and rainbows for women who have children younger, right?
Exactly. So again, that personalized approach, yeah? An issue that all women face is, yes, decreased egg quality and quantity, but it's really quality that tends to get them the most. And it's just upstream being aware of that and aware of the options and opportunities they have around their fertility at an age that they still have those. To every woman out there listening to this, you are as fertile, as depressing as this can sometimes seem, you're as fertile as you're ever going to be now. And so take that moment, learn about your fertility, and then make some informed decisions around it.
Let's talk about eggs then. You just mentioned, it's quality and quantity as you get older. But if you are someone who, say, took the oral contraceptive pill for a really long time, so you're essentially not ovulating, does that make a difference to the quality and quantity of your eggs as you age?
Yeah, I know, because the message out there is that you're born with a certain number of eggs and kind of like, coins in a bank. And if you're not spending them much, then you must still have heaps when you get to 43. Yeah. The problem is that it's more kind of like a smoldering fire. So it gets lit when you're born. Yeah. And that will keep on smoldering, whether you're using it or not. So sure, you've got a certain number of eggs and you might not be ovulating them, but the ones that are still sitting there in the ovary waiting to be ovulated will be slowly dying.
That's so depressing.
I know. It's better to rip the Band-Aid off and realize what it's like. So I think, the other thing to realize is that when we're doing things like egg retrievals for IVF or for egg freezing, we're therefore not stealing them from your future. We're just giving your eggs a chance that they wouldn't have otherwise had.
So if you are thinking about freezing eggs, what's a really good age, you think, to start thinking about that? And essentially, we are taking them out of the fire to put them on ice. Is that the idea?
And putting them in the freezer.
Yeah, okay.
Yeah? And you freeze your eggs at 30, 35, whatever age you do it, yeah, and then take them out of the freezer 5, 10, even 15 years later. They're still going to behave like eggs of the age that you were when you froze them. At the age of 30 is a really great age, yeah, because you've still got these eggs that are fantastic quality. And I think you've lived a little life. You can see where your life is going in the next 5 to 10 years. Like a 20-year-old, thinks everything's going to be fantastic, right? And isn't really thinking about that sort of stuff. You just don't have that maturity. But, by 30 and 35, certainly you've got high enough ground that you can have that vantage point to say, okay, where am I in life? Do I want kids? What social situation am I in? What resources do I know about, what I don't know about, and therefore should find out about? And considering the options and opportunities that, say, egg freezing would give them in the future.
What lifestyle changes would improve my fertility as a woman, but also if I am in a hetero partnership and I'm looking to conceive with a man, what lifestyle changes can he also bring on board to increase his fertility and maybe have us working together to be more fertile?
I guess what we want to do is support just in general a healthy lifestyle and avoid a blame sort of situation that, here I've got my 8th negative pregnancy test in a row and it's because I had a cup of coffee or one glass of wine when I went out for that, night that I really wanted to enjoy, So we want to keep it doable. We want to keep it evidence-based, but in general, not smoking is a really good thing. And I think the thing is also appreciating what you are doing just as a default. So if you are a healthy weight and don't smoke, then that should be sort of celebrated and say, great, we are doing everything. We always want to do more. And sometimes that's not always what's needed and actually just makes it harder and more stressful.
How much does stress play a role in fertility? You mentioned it there. I've heard so many stories of women who've gone through round after round of IVF and so stressful, and then all of a sudden they decide to stop and then they fall pregnant naturally. And a lot of that is attributed to the decrease in stress. How much of a role does it play?
Totally. And again, I think we want to just be careful of the flip this. If you're stressed, that's why you're not conceiving and you should get stressed, which is a positive feedback loop and just creates more stress. I don't think that we're ever really going to understand that, to tell you the truth. Yeah, it's really hard to study, and you're right. Like, I have patients who then go on a holiday and conceive. Whether they would have just conceived anyway, it might have just been that egg and that sperm. But I guess what we really want to do is when people are focusing on conceiving and it's becoming a little focused, to make sure that we've got a in-depth support network in their corner to help them manage stress, because it can get stressful. So, as a fertility specialist, I talk about eggs, sperm, pelvises, science, medicine, all this sort of stuff. But rarely do I get to say, hey, how you doing? How's this affecting you all? And so having, a good psychologist, counselor that's experienced in this sort of thing and having a space that it's encouraged for you to get that out and workshop that can be really useful.
Can we talk about genetic screening? What moment do you think about genetic testing? And then what do I need to consider results of if I'm, having trouble falling pregnant?
There's a few sort of checkpoints in terms of where genetic screening can become relevant, and particularly hard to probably decipher all that for patients out there. So I guess upstream prior to conceiving, there's extended genetic carrier screening. So this is where to see if you're a genetic carrier. I mean, most people are going to know if they've got a genetic issue by the time that they're ready to conceive, but they won't know if they're a carrier for something, and they almost certainly are. But there's all these conditions there where you need to get an abnormal gene from both your mum and your dad to actually have the condition. So if you're in a partnership, this is where we can screen both of you and to see if that's even possible. Important to say that it's very uncommon that you're both a carrier for a really rare genetic condition. And then even if that is the case, there's only 1 in 4 chance that any baby will have the condition. But it's important that every person that's out there thinking about conceiving is aware that they can screen for those conditions. It also probably, getting a little bit more attention now is that there's a Medicare rebate if you screen just for the 3 most common conditions: spinal muscular atrophy, Fragile X, and cystic fibrosis.
What's the success rate of IVF? And when do you start to consider IVF as an option when you are trying to conceive?
When to consider it is going to be, I would say it's considering fertility treatment, and even upstream of that, considering being investigated. Yeah. So step 1, pair up with a good doctor that understands you and find out what you're dealing with. Second, look at all the options, not just IVF. So there's other options usually prior to that. And you should understand the pros, the cons, the chances of success, level of invasiveness, and cost. And then IVF, I guess, is usually one of the most well-known fertility treatments, where we get eggs, sperm, put them together in the lab and grow embryos, put those embryos back. In terms of when to sort of get investigated for that, I think it's important to again point out that investigation doesn't equal IVF. And that's something that people often hold back, which is a real shame when I see it, yeah? That being informed doesn't necessarily mean being railroaded into a certain pathway. I would say that, most fertility specialists are just here to help you navigate this territory and protect you and nurture you and advocate for you during that, rather than just write a script for an IVF cycle. Sometimes we find, okay, egg and sperm's lousy, unlikely to conceive naturally, or all tests are normal. We haven't really found out what's going on. So let's get egg and sperm under the microscope, like I was saying before. And sometimes we never really know. And we do IVF and it works. I'm certain that our knowledge in fertility is like an iceberg. We just know the top. There's all this stuff that we're yet to work out. And we hope that the stuff that we do know and the treatments we have available also fixes that other stuff.
I'd love to get your take on your top tips for helping you get pregnant that aren't necessarily just like have tons of sex and hope for the best, because sometimes that's all we've got.
I would say, first of all, understand your cycle, because often, people aren't having that much sex. And so we just need to make sure that egg and sperm are there at the right time. So you can do things like ovulation tracking. You don't even need to leave your bathroom to be able to try and get a bit more of an idea about that. And then I guess, thinking about things like taking folate and all that stuff, just making sure you're ready for a pregnancy, and then probably just going for it. And maybe also just trusting the process for at least a while, trying to block out all of that noise that constantly feeds on your phone. We're in an era that can sometimes be overwhelming, and fertility is an area that can breed desperation, and that makes patients vulnerable. So I would say, if you're ready to escalate, then make sure you're doing that in trusted hands and get people that can help guide you, rather than just being pinged around from Instagram post to Instagram post and changing things every month and just feeling completely scattered and lost.
So, Miriam, I know that you have personally gone through this journey and struggled to conceive. How did you find Justin's advice?
I really liked when he was speaking about stress and trying to conceive. And I cannot tell you the amount of times that I visualized punching people when they would tell me, just relax and it'll happen. Like, please do not say that to any female that is trying to conceive. It is just so dismissive and it's invalidating, and it places the blame entirely on the person who's already trying to do everything they possibly can. It's the worst thing you can say to someone who's trying to conceive. But here's the complicated truth. While stress isn't the cause of fertility, the pressure we put on ourselves when we're in that situation, inside that infertility bubble, it's real and it's really suffocating. I've lived that. You've got the constant tracking, the timed intercourse, which my husband hated. Like, come home now, I'm ovulating.
Does not feel sexy in the slightest.
It is not. And the endless appointments and the hope that builds and the heartbreak that follows when it doesn't work out. It's a cycle that chips away at your sense of self, you know. And for me, it was more than just disappointment. It was all consuming. And what makes it harder was the pressure to stay hopeful and positive and don't stress when I felt exhausted. But yes, I was another one of those Justin stories where, you know, we were actually due to start our IVF journey. And my fertility specialist said, look, why don't you just have a good break and then come back and we'll start IVF. And I was like, you know what? We've been on this journey for a while now. We went to a friend's wedding in Chile and I was doing all the things that you shouldn't do when you're trying to get pregnant. I was actually having sex for fun.
You heard it from Miriam. Don't have sex for fun if you want to have babies.
And yeah, doing all this crazy stuff. And that's when we conceived the twins. It's crazy. Yeah. It was
Chilean twins.
Yeah.
I love that.
The magic of Chile.
Yeah, but no, I understand, like, saying to people, I saw on Sex and the City that as soon as you stop IVF and go on a holiday, you have a baby naturally.
No,
like, it's not.
It's not like that, you know. It's just, there's just no response to that. But for me, I think it was just releasing myself from that pressure that I'd put myself under for 2 years, which was intense.
Yeah.
But please do not say, just relax. Don't say that.
Note to self, don't tell Miriam to just relax.
Okay,
on the way. Could your teeth and nails point to a problem with your gut? We'll find out the answer to that question from Maria in just a tick.
The doctor will see you now just through here to consult room 1.
Alrighty, we're getting our gluten-free on right now because our friend Maria has a question about a bunch of symptoms she's been told could mean she's celiac. Miriam, would you please invite us into the consult room?
Thanks for waiting. How can I help you?
So Maria sent this question via our waiting room, which is a way you can submit your questions anonymously. There's a link to that in our show notes, but you can put your name to it too, like Maria has. You can also email it, at mamamia.com.au, or drop us a DM on Instagram.
Damn.
We are Well by Mamamia if you want to look for us. Now, Maria wrote this.
A friend of mine has been diagnosed with celiac, and she was telling me about some of the symptoms her doctor told her are related, like being lactose intolerant, having anxiety, weak nails, and lots of cavities. I have all of these. Are they really signs of celiac? And what do I tell my doctor to maybe be properly diagnosed?
Okay, great question. So yes, these symptoms can definitely be linked to celiacs, and it's more common than we actually think. So in Australia, we say about 1 in 70 people have celiac disease, but around 4 out of 5 are undiagnosed. So only 1 in 5 actually have a diagnosis. So I'll just start with what it is. It's an autoimmune condition where gluten, and that's found in things like barley, rye, oats, and wheat, it triggers an immune response that damages the lining of the gut, okay? And that can lead to poor absorption of nutrients and a wide range of symptoms. So that includes gut issues, which a lot of people with celiacs will tell you. They get bloating, diarrhea, constipation, nausea. But you can also get fatigue, low energy, brain fog, and a big part of that is because of the iron deficiency. Some people get mouth ulcers or skin rashes, and then the dental aspects we were speaking about and the weak nails, lactose intolerance, and that happens as the damaged gut can't process dairy well. Sometimes you might have fertility issues as well, or irregular periods, and you can get mood changes like anxiety or depression. So, yep, it's definitely worth looking into if you're ticking off a few of those. And what you should do is let your GP know you're experiencing those symptoms. You want to be tested for celiac disease. They'll start with a blood test which checks for specific celiac antibodies. But here's the catch. just don't go rock up and do the blood test. A lot of people have eliminated gluten from their diet before they do the blood test, and then it will come back negative. So
you have to eat some oats and whatnot in the lead up to that?
Yeah, that's right. You need to be eating gluten daily for about 6 weeks before the blood test. It's equivalent to about 10 grams a day, which is about 4 slices of bread, or the test won't be accurate. If the blood test is positive, you'll be referred to a gastroenterologist for a gastroscopy and biopsy to confirm the diagnosis. So yes, if your gut, mood, skin or energy feel off, and especially if you've got things like iron deficiency or a family history is another big one. If you've got a first-degree relative with celiac disease, you should definitely get tested.
There you go, Maria. Go eat some bread, go to the doctor, ask for a blood test.
I've been diagnosing one every week.
Really?
Crazy. Yep, in lots of young girls with iron deficiency. If you have iron deficiency, you need to know why. Don't just keep taking your iron supplements. You need to know why you are iron deficient. Either you're not absorbing it, it's either your diet, you're not eating enough, or you're losing it some way, whether that's heavy menstrual bleeding or through the bowel. So it's also really important, if you've got iron deficiency, make sure you see your GP and you understand why you're iron deficient.
There you go. Thank you for the question, Maria. Okay, thank you so much for spending time with us today, learning some cool stuff about our bodies as we do. We'll be back again next week where we'll move on to the next phase of fertility, the pregnant bit. Mariam, were you a good or a bad pregnant woman? I am one of those that loved every single second of it. I have great hair, great skin. I mean, I did fill up like a water balloon towards the end, but other than that, I bloody loved being pregnant.
Okay, I hated being pregnant, and I love that some people do, like each to their own, but I hated my pregnancy. I had hyperemesis because I carried the twins as well. I got so big. I was like sleeping in a recliner. I had that massive pelvic girdle pain, and I was just a bitch because I was completely exhausted. I was so mean to my husband. I
can't imagine you being a bitch. You're so nice.
So mean to him. Like, oh, goodness, I look back at that period with disgust with myself, but I just had no control. And I had so much anxiety during that pregnancy as well. My obstetrician said not to get excited or buy anything for the kids until I got to 35 weeks, just because I've had recurrent loss prior to.
Yeah.
So I'm like this massively pregnant female, and you know, people obviously know I'm pregnant, I'm out and about, and I can't be excited about it because I'm not sure if I'm going to lose these twins. So it was, it was really tough. Yeah, it was a tough pregnancy.
And that is the thing about pregnancy too, is that it's such an individual experience, which is what we found when we talk about this. It's not always an easy topic of discussion because we all have such individual experiences with it. We'll get more into that next week. Don't forget, though, to sign up to the Well newsletter. It has tons of great stuff and we can send it right to your inbox. Just hit up the link in our show notes. We have to remind you always at the end of all this that the information you've heard here today is general. It may not be suitable for your situation. So make sure you speak to your own healthcare team, hoping you have a good one in place, to ask the right questions about your symptoms, diagnosis and treatment. And we'll catch you this time next week for your next appointment.
Bye-bye. And if you're iron deficient, get your celiac serology.
Well is produced by me, Claire Murphy, senior producer Sasha Tannock, with audio production by Scott Stronach and video production by Julian Rosario.
Mamamia acknowledges the traditional owners of the land we have recorded this podcast on, the Gadigal people of the Eora Nation. We pay our respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander cultures.
Hi, I'm Obstetrician Dr. Patrick Maloney.
And I'm Bridget Maloney. We're the hosts of The Kick, the pregnancy podcast that breaks down everything you need to know about making and growing a tiny human.
We cover it all with expert information and evidence-based discussion based on our experience of running a women's clinic and being parents to 4 boys.
From morning sickness to birth plans, strange cravings to baby movements, listen to The Kick wherever you get your podcasts.